Good morning, everyone. My name is Veronica Judy Cecil. I'm Senior Deputy Commissioner for the Kentucky Department for Medicaid Services.
Medicaid.
And welcome to our Medicaid Monthly Virtual Meeting. We are just going to pause for a moment as we have folks enter. Just a reminder, if you could please mute as you enter the meeting. And we'll get started in just a moment.
Can you? I'm not sure.
Good morning, everyone. Welcome to the Medicaid Monthly Virtual Forum. We are allowing folks to come in. We had a wonderful number to register, over 500. We were excited to see that. So we're going to give folks just a moment to be able to join us, and we'll get started. Right, we'll get started. Again, my name is Veronica Judy Cecil. I'm Senior Deputy Commissioner here at the Department for Medicaid Services. We welcome you to our Medicaid Monthly Virtual Forum, especially if you're with us live today, or if you're watching a recorded version. We will record this and post it to our website so anyone can view it at their convenience. Let's go to the next slide, please.
Well, yeah, hold on.
Our agenda items for today are our typical Medicaid department updates. We'll be going over our regular Medicaid renewals and the flexibilities that we've implemented under the public health emergency. A brand new Medicaid child renewal toolkit that we're going to share with you all. Our update on our 1115 reentry initiative. Our Families First implementation. This is a brand new initiative that we've just launched. And we'll go over, we've talked previously about the federal final rules that we are putting into place to be compliant. And one of those involves the Medicaid Advisory Committee and Beneficiary Advisory Council. So we're going to be going over what those rules are and what that implementation looks like. And then we have our wonderful Dr. Judy Terrio here to talk about our Healthy Kentucky Home, a hot topic, and that's on mental health today. So next slide, please. And just a reminder, folks, if you could please mute.
Okay, bye-bye.
All right, next slide, please. So for our monthly meeting, we always try to provide you all the most current information on our renewals, our Medicaid renewals, and also where we are on the flexibilities that we implemented as part of the public health emergency. Just as a reminder, we were able to extend those once we came out of the COVID-19 public health emergency, extend many of those flexibilities through June of 2025 to help states re-enter the annual renewal process and to actually provide support to members through that unwinding. So just a reminder that those are coming to an end on June 30th, and a couple that we want to highlight to make sure you're aware of. One is that we will be having to do an active redetermination of children, or we're going to restart redeterminations of children. So up until June 30th, we have been allowed to just automatically extend a child's renewal, but starting with new renewals in July, they will have to go through a renewal. We've been able to extend all individuals 1 month and up to 3 months for anyone that was a long-term care or 1915C home and community-based waiver member if they were sent a renewal packet and they had not responded by the end of their renewal deadline. So we could automatically extend them and gave them additional time to provide us that renewal response. Those will also go away. We will no longer be allowed to extend someone if they've not responded by that renewal date. So that will become a very important date for folks to comply with after June 30th. And the other thing we wanted to point out is we have been allowing an authorized representative to sign an application or renewal form via the telephone without a signed designation. So after June 30th, we will have to have some type of signed designation by the member or beneficiary for that authorized representative to act on their behalf. So that's another important change that we'll be seeing coming up on June 30th. But as we've noted here, messaging to members remains the same, and that is make sure that we have your updated contact information. Let's go to the next slide. So make sure that we have your updated contact information. It's very important. We even ask providers that if a member is coming in to just check with them, because they generally ask, you know, do you have a change in your contact information? If they report a change in their contact information, just to ask, did you also report that to the state? It's important for us to have that so we can contact members when they're going through renewal. We do have a very proactive outreach campaign for members to try to reach them when they are going through a renewal, that they respond to any letters that they do receive or any notices if they're in the self-service portal on Connect. That goes into their email box to make sure they're watching for those and responding to them. And just know that we're out there to help. So they could call Connect, our 855-459-6328 number. If they have self-service portal, they could go through Connect. We have connectors and insurance agents all across the state. So they're in every community that could help somebody navigate that as well. Next slide, please. So we're always looking at our trend, and as you can see, as we came out of public health emergency and started those annual renewals, we have started to just sort of temper just a straight line there where we're seeing not a whole lot of new people come on or losing a lot of people. That's staying like a steady number. So here, as you can see, we keep hovering around 1,450,000 individuals enrolled in Medicaid at this time. Next slide, please.
We text a few times here. We've got just been.
And so you know, reinforcing that we did restart those annual renewals. We have a new member toolkit available online to support members understanding their coverage. Lots of communication materials to support members and families, and especially those with children going through a renewal. And we've got monthly and updated reporting that's happening to the Centers for Medicare and Medicaid Services. Next slide, please. I mentioned those reports, and here we're not going to go through this entire spreadsheet, but just this is to provide information to folks who might be interested in knowing what's happening with renewals. Just looking at this, the last date there, the December month, we had 38,604 individuals that went through a renewal. We were able to approve 33,235. We're looking on the left side of the chart here. We had 819 that were terminated, and we had one pending. And pending means that the person responded, but the state had not taken action on the case yet. So it crosses over that renewal date. So it crossed over December 31st, and that was considered a pending case. On the right-hand side, what you see is an updated report. CMS had asked us 90 days following the month of renewal to provide them an update on any pending actions that were processed. So as you see here for that December renewal that was pending, that one, we were able to process that person and actually approve them. So they got put into their approval bucket there on the right side. So what you're seeing is from January to December of 2024 displayed here. Each individual month's renewal report and updated report are all on our website. So if you really want to get more in depth into what that looked like for that month, you can certainly go out there and check those out. Next slide, please. And what we're looking at here are the most recent months that we've gone through renewal. So we usually use the past 3 months. And on this table, what we're going to look at is March. So in March, we had 76,683 individuals go through renewal. We were able to approve 67,120 of those. We did have to terminate 1,708. We didn't have any pending at the end of March. And there's that extended bucket. I talked about the flexibility where we're able to extend individuals. So we had 7,855 individuals we were able to extend in March because they did not respond to a renewal packet. Again, that is going to go away on June 30th. So that's a lot of folks that would more than likely be moved into the termination bucket for lack of response. On the far right there in the reinstatements, one of our current flexibilities is also being able to reinstate someone 90 days after their termination date. And if they contact us and we're able to get them determined eligible, we can bring them automatically, reinstate them back to that termination date as if that termination didn't happen. So if they contact us within that 90 days, then we're able to do that. So for March, we've already had 363 folks that have come back after they got terminated, and we're able to provide the necessary information for us to determine them eligible. Next slide, please. This is a sample of the materials that we do have out on our website, which I'll share with you shortly. We always encourage folks, regardless of who you are, if you're an advocate, a provider, a family member, we always ask folks, you're welcome to take this information, to print it off, to post it, to share it, to email it. We're always trying to get the information out there to help members navigate that renewal process. So please feel free to share any of these that you all might find helpful. I think we have 2 fairly new ones, and that's the far left. How do I apply for Medicaid? And the far right, getting ready to renew. We are always interested in hearing if there's additional material that would be helpful to folks. So if you have an idea, don't hesitate to reach out to us and suggest that. We are always open to those recommendations. Next slide, please. And this you're seeing for the first time. We are happy to announce the launch of our Child Renewal Toolkit. So on our website, we have posted the toolkit. It includes a frequently asked questions document and several flyers like the ones you see here that we will be distributing very broadly. We're giving them to schools. We have partnered with the Friskies and in the schools, and we're hoping to distribute this to parents. We're going to try to distribute this far and wide. So this is another one where we're going to encourage you to please feel free to pull this down and to share it with all of your networks so that we can get this information out. You know, folks probably haven't understood the fact that their child's renewal has just been automatically updated, and they're going to have to go through that. I think the other thing we want to emphasize to folks is that a child's eligibility is very different from a parent's eligibility in terms of their income level. So most parents may think, well, I'm not eligible, my child's not eligible. That's not true. A child may still be eligible. So we encourage parents, families, guardians to please to submit that renewal so we can make the determination as to whether or not that person, that child is eligible. So very much encourage the wide distribution of this information. And I've seen a couple of, and Erin, if you could put your, if you have a question, put it in the chat. So let's see here. The presentation does get emailed, I think, to the registrants, everybody who has registered. And it is also posted on our website within at least a day or two with the recording of this presentation. Great question. And the images in the chat, I'm not sure what that question is. There's a question about when will Medicaid website be updated each month that a member has been terminated, so we know whether to provide services. And Chris, I don't know if you're talking about the Kentucky Health Net, which is the system that providers utilize to check a member's eligibility. That's real time, so it's generally, you know, within hours of a member's termination. So Erin asks, is this an app for parents? It's not an app. It is actually just a toolkit that's on our website that you can then download the different documents that are there. All right, so let's move on. I know there's still a couple of questions and we'll try to get to those, but next slide, please. So we do have just another reminder. We have a member toolkit on the website. This is fairly new and hopefully helps members navigate Medicaid coverage. Next slide, please. And this is our website. Lots of great information. The previous stakeholder meetings, these monthly virtual meetings are posted there, as well as those materials, all the reports we talked about today, and all of those different informational flyers, bulletins, and other information is on the website. So we encourage you to visit it as many times as you want and to pull that information down. Next slide, please. And now I'm happy to turn it over for a reentry update.
Good morning, everyone. I'm Kristen Schroyer. I am one of the behavioral health specialists within the Department of Medicaid. Next slide, please. We do not have a major update for today. We received approval December 12th for our demonstration components, which includes everything that's on this screen. And we are technically approved through December 31st of 2029. Next slide is fine, please. Like I said, we don't really have any major updates. As we have everything approved, we are now working through our timeline and trying to prepare for monitoring protocols and all the fun components and requirements that come with our Team Kentucky 1115. So as of right now, that's the only update. Lots of meetings, lots of talking, lots of planning to continue to meet our implementation dates for the fall. And that's all I've got today.
Kristen, this is Leslie. I just would like to add that in 2026, we plan to explore presumptive eligibility once we get a little bit further down the road with our implementation. Thank you. And I'm next. Hello, my name is Leslie Hoffman. I'm a Deputy Commissioner in the Department of Medicaid. And I'm going to be going over the Families First, that's plural, Families First implementation. Next slide.
What if everything we needed to build a better system serving children and youth was already within reach, just waiting to be realized? We start with the child and youth and the specific needs they have. And we ask not just what is needed in the hardest moments, but what it takes to build strength, stability, and resilience from the start. If we choose to strengthen the foundation, create a responsive infrastructure, not just a reactive one, to ensure every service and support actively contributes to healing, not just fills a gap. Commit to a clear, consistent communication that informs and connects. Tracking not just activity, but the outcomes that matter: safety, stability, well-being, healing, and growth. Then we can realize our most basic promise to Kentucky's children, youth, and families. Resilient families. Responsive services. Healthier futures. Here's how we do it together. Kentucky's Family First, transitioning from vision to action, an implementation roadmap.
Okay, so I love that voice overview and just the passion that the team that has worked on this vision has been amazing. So Families First is a vision to action. That's what we plan to do. Kentucky is turning our aspirations into our actions, a new way of working together across all systems, across along with children and alongside families. This Families First initiative will be a multi-year initiative beginning in 2025. Next slide. So again, Families First is a comprehensive multi-year initiative aimed at enhancing the existing system of care for our Kentucky children and youth. And these are just some examples that we have that are embedded in this initiative. First, you will see the Shine Kentucky, which is a grant that we were able to obtain here in Kentucky, enhancing access to the delivery of school-based services for Medicaid and CHIP eligible and enrolled individuals. Our SHINE stands for Strengthening Health Integration in Education for Kentucky Students. Next up is our Kentucky Cares, and this is also part of our services to support community reentry and improve care transitions for justice-involved youth. We also received a grant to go along with these initiatives. It is also called Kentucky Cares. CARES is continuity of access to resources and essential services. Another piece of this initiative that we're very proud of is called our CHI mapping tool, which stands for Children's Health Initiative, and that is the tracking and reporting of all systems and programs across the Commonwealth. So that's something we've been very proud of. We also have funding modernization, which is the restructuring of Medicaid payment for medically necessary treatment services. The children's waiver, if you remember, we have in the previous budget for fiscal year 26, we have funds for a children's waiver, and that is to locate appropriate resources and housing for children and youth in need of placement. We also are taking a look at our high needs services area, services designed to meet child-centric care, support services, housing, custody, and placement, and other health-related social needs, or HRSN, as you will see it. Our Families First seeks to create a unified, integrated, and child-centric care framework that addresses diverse needs of Kentucky's youth and young population by enhancing coordination across our health, our education, our social services, and other key sectors. Families First aims to ensure that every child and youth receives the necessary support that they need to reach their full potential. Next slide. So we're putting the pieces together. We've got a phased rollout plan. We have cross-agency partnerships. We have provider engagement. We have partnership feedback loop, and we are tracking what matters. Families First is no longer just a vision. It's finally becoming a reality. I'm so proud to be working in the administration that it's becoming a reality. Next slide, please. So what changes for families? Families First is about enhancing services that work better, not just adding more. So we want simpler access. We want children and youth to get help earlier and more consistently. And we want integrated services for behavioral and medical and social needs to be addressed together. and stability first. We want healing and development over disruption and delays. Next slide, please. So this is our 2025 through 2027 Families First implementation roadmap. We started very early working on these projects. If you will see, the Kentucky Cares is a reentry service for justice-involved youth that I mentioned earlier. Phase 1 is now already available in January, and Phase 2 is available in October of 2025. We also have the Children's Health Initiatives to improve care coordination across the state that also occurred in 2025. We have the complex needs and service delivery meeting child-centric care needs in 2026, as well as the funding system modernization and children's service delivery also in 2026. And you'll also see Shine Kentucky that I mentioned earlier is to enhance our school-based service needs, and that will be from 2026 and 2027. Again, next slide. Again, this is just a high level of what we have planned for you, and absolutely there is more to come. If you are aware, in March, we held our first town hall meeting. We had over 294 folks that registered, and we had over 200 that came to the town hall. So if you were able to enjoy that, I'm so glad you did. This PowerPoint presentation is very similar to the one that was given out that day. If you wonder if you weren't available for that particular event. As far as upcoming events, we have the funding modernization roundtable sessions coming up. One will be April the 30th, one will be May the 14th, and one will be, it's still to be determined in June. Those three will have registrations, and for more information about upcoming events, you can contact our Melissa Goings, and she is the director for Friskies. I'm sure you've probably seen her around. She's been around for quite some time, but you can contact her about upcoming events and any registration questions that you may have. We'll be putting that out on social media and those kinds of things very soon. Next slide, please. So just for your knowledge, if you have any DMS questions, this is our DMS homepage and our DMS behavioral health issues box. And you can also just email directly to dms.issues@ky.gov. If you would put in your email title that this is just about the Families First initiative, we would appreciate it. Again, just a reminder that this Family First initiative is a much broader initiative that includes many things along the way, but also includes that child's waiver that many of you all continue to ask about. So it's one and the same now. Next slide. I think I'm done. So thank you so much for listening to me about the Families First. We're very excited about the upcoming changes.
Thank you. And you might want to check, if you don't mind, the chat. I tried to keep up with folks. I do want to pause for a moment to address two things that was not on the agenda, but happy to talk about because I know a lot of folks are interested. And one is the reinstatement of behavioral health prior authorizations. As a reminder to folks, House Bill 695 requires, in Section 20, requires the department to reinstate behavioral health prior authorizations, as were noted in January of 2020. So we have been working with the managed care organizations on that implementation. That they have to be they have to be put back in effect on June 25th of 2025. So providers should be seeing in the next month those notices. The MCOs are required to give a 30-day notice prior to implementing any prior authorization. So you will get at least a 30-day notice. And we've been working with the managed care organizations to ensure that they do provide training to providers. We know that this is, for some of you, the very first time that you've had to request a prior authorization. So there will be training. So just please be a little patient, and you should hear something around, I would suspect around the 1st of May, so that they can get that information to you all and then have those the training prior to the prior authorizations going into effect, and offer those trainings even beyond that date. The second thing I wanted just to discuss is the other component of House Bill 695, which requires the department to apply for a community engagement waiver. The department is working on that right now. We're in a very short time frame because we have 90 days that we were required to comply to that. So there will be a public notice period. So we are quickly working on drafting that waiver. It will get published for public notice. I don't know, Dr. Hoffman, if the date that'll probably happen is sometime in May to expect that. And we will send out notices to folks through our regular email distribution list. If you're not on our Gov delivery distribution list, we'll post that before the end of the meeting so you can sign up. It's a great way for you to stay in touch on those types of things. We try not to overwhelm folks with information through that, but really vital information about things that affect the program that you should be aware of. So just wanted to note those two things. So really appreciate those comments in the chat. So let's move on and talk about the Medicaid Advisory Council and Beneficiary Advisory Council federal changes. Let's go to the next slide, please. This slide may look familiar because we've talked about it on these meetings, and we've talked about it on lots of different meetings that's held with the department. As we noted, there was a new federal rule that went into it, that was passed and went into effect. And it was the Ensuring Access to Medicaid Services final rule. And it made changes. It requires states to make changes to comply with a Medicaid Advisory Committee, which all states already have. That was a long-time federal rule that was created in the 1960s. But every state is very different in how they implemented that regulation. It also requires that states have a beneficiary advisory council. And Kentucky does not currently have one, and most states don't. So this is brand new to Kentucky. We held a couple of forums in December and conducted a survey with folks. And if you're interested in going back and watching all that, that is on one of our websites. So you could find that information if you want to go back and kind of learn more about what's going on and why we got to where we are. But this just highlights some of the MAC areas and back areas that are really subject to change. And probably the biggest one is that the members on the MAC and BAC will have to be appointed by the commissioner. So currently, let's go to the next slide. Currently on the left-hand side is our current Advisory Council on Medical Assistance. And on the right-hand side is what the federal rule changes are. And I know that's kind of small, but you could take a look at these a little later if you want to really kind of dig into it. So on the left-hand side, the current Advisory Council that's created in KRS 205540 is appointed by the governor. Under the federal rule, they must be appointed by the commissioner, the Medicaid commissioner. So that will change. The size of the current Advisory Council is 22 members, and they have 4-year terms, and they can serve consecutive terms. But on the right-hand side, the federal rule does give states discretion on how many members are on the size of the Advisory Council, but they cannot serve consecutive terms. The state law allows the members to meet at least quarterly, and the federal law aligns to that. And then just to skip down to representation, there is a little bit of a difference between what's in the current state law and what the federal law requires as part of the federal law requires as part of the representation. Let's go to the next slide. So what does the new Medicaid Advisory Committee look like for Kentucky? And we have to comply with this by July 9th. What we're going to do, we had filed or requested some legislation to try to change the state statute to comply with the federal statute, but it did not get out of the General Assembly. So what we're going to do is take the current membership that's in the KRS 205540, but they will be appointed by the commissioner. They'll no longer be appointed by the governor. Current members that are serving on that MAC will continue to serve and be automatically appointed to the new MAC if they have an unexpired term. If there's a vacancy or expired term, it would be filled with a new nomination or application. We also, in order to be compliant, have to add the following individuals to the new Medicaid Advisory Committee. That includes commissioners or their designee as ex officio non-voting members. That's from the Department of Public Health, from Community-Based Services, from Medicaid Services, and from Behavioral Health, Developmental, and Intellectual Disabilities. It also requires that there is a representative from a current Medicaid managed care organization. And then the last major change to our current state statute in the federal rule is that at least 25% of the Medicaid Advisory Committee are members of the Beneficiary Advisory Council, the brand new Beneficiary Advisory Council. So that's a major shift in membership from our state statute. The terms will continue to be 4 years, except upon initial appointment after July 9th. We will have staggered terms to ensure that not everyone is being reappointed at the same, or vacancies are being appointed at the same time. So you are going to see that even for those that are currently serving on the advisory council, that they'll get a new staggered term. And then again, just to reemphasize, the consecutive terms are not permitted. There's been a lot of members who have served consecutive terms, so this will be another change. But they can be reappointed after a 4-year period. Next slide, please. Talking about what our new Beneficiary Advisory Committee will look like. Again, the Medicaid Commissioner will appoint through an application process. We plan on having 15 members, 10 of whom will be beneficiaries, so actual Medicaid recipients, and 5 who will be representing a parent or a paid or non-paid caregiver. They also will serve 4-year terms, except upon initial appointment. They will be staggered terms. Again, the consecutive terms are not permitted for the back, but they may be reappointed. A person may be reappointed after 5 years. The back must meet before the MAC. The federal rule is clear to say that the back has to meet before the MAC, and part of that reason is so that it allows the back members to be prepared to participate in the MAC. Members may receive financial support or other accommodations to facilitate participation. So they perhaps they need some personal needs assistance to participate, and we will be working very closely with those members to identify what their needs are and to provide those to them. And then the other thing that's very different from what is allowed in the state due to state law, members can request that their names remain private and that meetings may be closed to the public. So those are 2 new things based on the federal law. Next slide, please. So our next step, we're going to file regulation since we couldn't get the legislation passed, and we need to implement by July 9th to be compliant with the federal rule. We will be filing regulations. Once we do that, we're going to launch a website specific to the new Medicaid Advisory Committee and Beneficiary Advisory Council. We'll be posting new MAC and BAC applications. The application process will be much different than the previous application process for the Advisory Council. Very simplified applications. And for members, we'll be providing a lot of support to them. We can actually take their application over the phone. We're going to try to make it very easy for members to apply to the BAC. We have a crosswalk for current members, current advisory council members. We're going to have a crosswalk on who gets reappointed to the new one and what those terms are. We'll be sending letters to every advisory council member and nominating organization. We're going to be distributing information through email lists. So again, if you're in our Gov Delivery email distribution list, you'll receive that information so you know what's happening. We're going to be conducting a lot of outreach, and we're going to ask a lot of folks to help us identify interested members who might want to participate. And then, as I mentioned, we're going to support applicants in that process. Next slide, please. And now I'm happy to turn it over to Dr. Terrio.
Hello, everybody. This month, the month of April, our Healthy Kentucky Home Spotlight is on mental health. And so we're going to be talking a little bit more about what we can do for our mental health. And some of this stuff is really easy. Next slide. When we talked about cancer prevention last month, we talked about eating healthy foods, exercising, and some of that stuff also helps with your mental health. So to be proactive and work on your mental health, it's pretty easy. Healthy eating, at least 2 servings of fruits and vegetables a day. Exercise, I don't like that word, but it's increasing your activity more than you do now. You don't have to run a marathon. And then engaging with others. So we're going to talk about those things and how they help our mental health. Next slide. According to the Center for Disease Control, nearly 1 in 4 adults, and that is more than 61 million Americans, report having a mental health condition. Good mental health, obviously, is essential to your overall health and well-being. And so you can incorporate just modest lifestyle changes into your daily routine and improve your mental health. And that's at every stage of life. So if you're 60, like me, you can't just say, oh, well, I'm 60. That's it. You can improve things even, at an older age. So next slide. We also have the Kentucky Behavioral Risk Factor Surveillance Survey that we do every year. The most recent year we have information from is 2022, and that showed that of Kentucky citizens, 38% were obese, 26% did not engage in any non-work physical activity. That being said, that means like if you work, I don't know, as an auto mechanic, so you're always up working, bending down, you can say, well, I get exercise at work. So that's not what we're talking about. We're talking about non-work physical activity that is counted towards increasing mental health. Less than half of people eat fruits less than once a day. Only 20% of people eat vegetables, or 20% of people eat vegetables less than once a day. And a lot of our citizens smoke. That's 17%, which is actually pretty high for the country. So next slide. So according to the 2023 America's Health Rankings, we ranked 41st out of all of the states for our overall health. So we really have to work on that. And then when you break it down by mental health, we have 746,000 adults in Kentucky have a mental health condition, and that is 10 times the population of Bowling Green. So that's a lot of people. Next slide. Back up to what the statistics are for the country, and 1 in 4 people, adults, have a mental health condition. So next slide. When we looked at adults who reported their mental health was not good for 14 or more days out of the past 30 days, we are much higher than the national average. The latest year we have is 2022. We are 15.2% of adults had more than 50% of their days as bad mental health days in the past month. The national average was 14.1%. But the good news is we're improving. We were a whole percentage point higher in 2021 than we were in 2022. So it's improving, but again, we have to keep working on it and just keep moving forward. Next slide. Moving forward for mental health. I love this slide because it's showing somebody that's walking. They're not, running a marathon. They're not, doing an hour on the elliptical machine at the Y. Now, granted, they're hiking, but it is just walking. And so just increasing your physical activity by taking a walk around the block can help improve how you feel, improve your mental health, improve anxiety. Another thing that moving will do if you're walking around the block is help you engage, because you're probably going to be seeing neighbors, waving to neighbors on the porch. Everybody has somebody in their neighborhood that's the gossip of the neighborhood. And so walking, you might run into Suzanne, who will tell you all the good gossip that other people have told her. She seems to know everything. So it will help you engage with your neighbors and will help you increase your physical activity. So next slide. And then healthy eating. Again, you don't have to like eat a salad at every meal, but if you just introduce, 1 or 2 servings of fruits and vegetables a day, which we showed that people are not doing, but just 1 or 2 fruits and vegetables, watermelon. I love watermelon. Things are coming out now that we're in the spring that we can get these fresh fruits and vegetables. That's all you have to do, and that really will reduce your risk of mental health conditions. Next slide. So on the darker side, an average 1 person in the US dies by suicide every 11 minutes. And in Kentucky last year, 800 lives were lost to suicide. And 157,000 adults in Kentucky last year had thoughts of suicide. So there are some things that we can do if you're in a crisis situation. So next slide. 988, hopefully all of you have heard about 988 by now. We all know 911, if you have a medical condition, a physical condition, and you need help now, you call 911. Well, if you have a mental health condition, crisis, suicidal thoughts, call 988. 988 is the number to call for mental health crisis. You can call it, you can chat, you can text. And somebody will answer 24/7. So this is a wonderful resource that we have within our state that hopefully, if you haven't heard about it, you know about it now, and you can spread the word. Next slide. We also have a resource, and it's a national resource for moms if you're pregnant or if you just had a baby. That's the National Maternal Mental Health Hotline. And same thing, you can call or text and get help from trained professionals. I like this, the number, it's 833-TLC-MAMA, and you can get help there. So those are 2 very important resources that you can spread the word about if you're having a mental health crisis. Next slide. And that's it. Do you guys have any questions for anybody? I'm scrolling. It doesn't look like you have questions for me.
Thank you, Dr. Terrio. Yes, lots of questions around behavioral health authorizations, and we understand why. It's quite a change to folks. And I first want to say I apologize. I put the wrong provider letter in the chat. That was the old provider letter. The new one that had just got sent out to folks, and hopefully providers are starting to receive those. It was dated April 8th, and it should explain a lot of the hopefully answer a lot of the questions that you have. So my apologies for even further confusing things by posting that. We understand that you really want answers now, but this just, keep in mind, passed on March 27th. We've been working with managed care organizations to understand what their requirements are. So we've been working with them about what prior authorizations had in place on January 2020, whether or not they wanted to request any new prior authorizations or make changes to those. So those conversations are happening right now. But again, the managed care organizations are required to give at least a 30-day notice. The legislation requires this go into effect June 25th. By June 25th. So between now and then, There's a lot of work going on around identifying what the prior authorizations are going to be, giving appropriate notice to providers, and instructions and training on how you submit that prior authorization. So we will keep folks updated, and happy again if you have, we will absolutely add this to the agenda for next month. So if your questions haven't been answered, we'll do our best to try to answer them then. And in the meantime, we will also try to keep folks updated through our GovDelivery distribution list on anything that changes with those behavioral health prior authorization process. And just to reiterate, we are in communication with managed care organizations to make them understand what their requirements are to help navigate this process. And excuse me, we will do our best to support providers through this. Just want to reemphasize this is we're complying with legislation that's requiring us to do this. And so we're all going to be going through this together, and appreciate your all's patience and understanding as we navigate it just as much as you all with the restart of behavioral prior authorizations, very differently than what we had planned to do when we were going to resume them. So the legislation did change our plans on how we were going to resume prior authorization. So that now is very different. So I will take a look just for any, we've had some questions about fee schedules. We are a little delayed in posting some of those because we're evaluating, Medicare decreases and increases rates on an annual basis. And so we have to evaluate that against our rates. And we have just reviewed the behavioral health fee schedule. I think that should be posting by the end of the month. Dr. Hoffman, if I'm making promises that I can't keep, let me know. But we just completed that review, so it shouldn't be too long before that gets posted. If someone can help me, thank you, Heather. Heather has posted how you sign up for our GovDelivery distribution list. Again, we try not to abuse that with sending just tons of information. We really are strategic in only sending emails that really are major changes or information we really feel like the public needs to know of something important that's happening, such as our reentry waiver, our Families First initiative, prior authorizations. When we launch the changes to the MAC and the BAC, and that the application process will be open, those are the information that we like to share through GovDelivery. So definitely recommend signing up for that. And just going to try to quickly
Veronica, I posted earlier that the community engagement will be discussed that's the plan to discuss in May.
All right. Doing a quick scroll to see if there's any other we are going to send an apologies for those who may not be interested in it, but for anyone registered today, we are going to send that behavioral health prior authorization, the new letter. We will send it to you today. Let's see. And just checking. Okay, I think we've generally answered most questions or have taken a couple back. This is always so helpful to us. You all always ask great questions, and especially for the things that we're working on. We appreciate the input. If you do have some topics of interest that you want to see on a future just let us know. Like I said, we'll definitely put behavioral health prior authorization on for next month, but if there's something else you all want us to address, would be, open to hearing what those subjects are. And if there are no other new questions, which I am not seeing, then we'll wish you a good day. And thanks again for taking the time to be with us today.